Hi, my name is Jennifer Ortega. I'm going to be doing the administering oxygen video today. I have my student ID. I have plain gray scrubs on. I still don't have my Nightingale scrubs, but they should be here soon. I have my sanitizer for hand hygiene, 2x2 gauze, non-rebreather mask, and the nasal cannula. I'm going to go ahead and turn the camera over so that you guys can see my patient. And we'll go ahead and get started. So first thing we're going to do, knock, knock. Enter the room, close the door for patient privacy. Hi, my name is Jennifer. I will be your nurse today. Can I get you to confirm your first and last name and date of birth for me, please? Patient would relay the information to me. I would go ahead and verify on their wristband. Everything looks good. We can move on to the next step. Next, I'm going to explain the procedure to the patient. So, Mr. Smith, the doctor ordered some oxygen for you today. It looks like your levels are a little low, so we want to go ahead and administer some oxygen to you. Is that okay? Patient agrees. We can move on. Hand hygiene will be the first step. And we're going to go ahead and grab the nasal cannula. Package is open because I've been practicing, but pretend it's new. So go ahead and pull that out. All right. So this part would be attached to the flow meter connected to the wall. So I went ahead and confirmed that this is green. This is oxygen right here. I'm going to go ahead and insert this to the flow meter like so. So now that we have attached that to a verified oxygen source, we can go ahead and place the nasal cannula mask on the patient. Nasal cannulas are anywhere from 1 to 6 liters per order. So we'll go ahead and apply this. These go inside the nostrils. These go around the ears. Turn this a little. And this is snug but not too tight, just to make sure that it doesn't fall off. Okay, so the mask has been applied. Next thing we have to do is educate the patient. Mr. Smith, please make sure that you keep this mask on at all times. I'll go ahead and come back and check on you later. If you have any pain or tenderness around your ears, or if you feel like your nose is getting dry, please press the call light and let us know, and one of us will come back and check for you. Okay, so we will go ahead and exit the room. And then we'll come back, knock, knock, open the room again, come back inside. Hey, Mr. Smith, it looks like your oxygen levels are still a little bit low, so the doctor went ahead and bumped you up to a higher oxygen level. We're gonna need to switch the mask. Is that okay with you? Patient agrees, we can move to the next step. All right, so the non-rebreather mask is the next step. So same thing as the first step. Go ahead and attach this tubing to the flow meter to a verified oxygen source on the wall. We're gonna disconnect the nasal cannula from the oxygen on the wall, and then connect this to the verified oxygen source on the wall. Okay, and we are gonna adjust the flow rate to 15 liters. And then we'll go ahead and remove the nasal cannula. And we'll apply the non-rebreather mask. Okay, mask has been applied. Next thing we're gonna do is put the gauze on either side of the ears, as well as the bridge of the nose, to prevent any breakdown of the skin. Okay, so everything's on there. And now we're gonna go ahead and educate the patient. Mr. Smith, please make sure that you keep the mask on. I applied gauze on either side of your ears as well as the bridge of your nose just to prevent any skin breakdown. If you have any pain, please go ahead and press the call light and let one of us know. We'll go ahead and monitor you every 2 to 4 hours just to check to make sure you're not getting any pressure injuries or any breakdown of the skin in those areas that I just mentioned. Do you have any questions for me? No, patient verbalized understanding, we can go ahead and leave. Then we would come back to the room. Hey, Mr. Smith, it looks like your oxygen levels have increased and you're doing a lot better. So the doctor thinks that we can go ahead and remove the oxygen for now. So we're gonna go ahead and remove the gauze on either side of the ears as well as the bridge of the nose. We're going to disconnect the oxygen or the mask from the flow meter on the wall and remove the mask. And we'll dispose of this mask along with the other mask in the proper bin, trash can. Okay. Mr. Smith, do you have any questions for me before I go? Are you comfortable? No questions, patient is comfortable. I'm gonna go ahead and perform hand hygiene and exit the room. And the last thing I'm gonna go do is document what I just did. And that's it.